Yeah, it happens every year. With the arrival of spring comes a new season of baseball, softball, track, tennis, golf. And it's important for athletes to condition themselves to get ready for the throwing, hitting, pitching, fielding over time. Joining us today is Dr. Brandon Cincere, orthopedic surgeon with Erlanger Ortho South practice. Doctor, welcome to our program.
Thanks for having me.
What type of athletes are more prone to get some of these injuries?
Well, for these shoulder injuries, it's mostly the overhead throwing athletes, the weekend warriors, the golf, tennis, baseball, those kinds of athletes.
Is it better to start slow and build up the things?
Oh, definitely. Start slow, in the off season, have a good strength and conditioning program, a program focused on mechanics and making sure your whole body's working together as a unit.
Yeah. Can you really stave off some of the, injuries?
Well, with a good strength and conditioning program, for sure, making sure you have the proper throwing mechanics, hitting, stroke, tennis, stroke, and tennis, making sure that proper equipment can definitely help save your shoulder and any other problem you may have.
I guess that's one of the most worked areas in a lot of sense.
It is. The shoulders has the most range of motion of any joint in our body, so it usually takes a lot of punishment.
When should an athlete be seen by an orthopedic specialist for these type of injuries?
Well, definitely for any kind of acute injury they may have, in the field or a practice, or if there's just a chronic ongoing pain where you're not able to participate, something that is going on for a while, it's better to get checked out sooner than later.
What about types of therapies are available?
Well, for types of treatment, there's definitely conservative treatments such as rehab. I think rehab physical therapy is great to get a lot of throwers back to their sports. There's also oral anti-inflammatories, occasional steroid injections, but I think the rehab and proper mechanics is probably your best conservative treatment.
Yeah. What type of surgeries are available and time for recovery too?
For shoulders and the upper extremity, mostly arthroscopic procedures. These are with small cameras, small instruments. They don't have the big incisions we used to have back in the old days several years ago. There are still some open procedures, but most of them are through small incisions with recoveries anywhere between 6 weeks and 3 to 4 months, just depending on the type of injury and the type of procedure.
There's always a problem, isn't there, with not only the shoulders, but a lot of face injuries sometimes. And, of course, they're beginning to wear more masks now, right, and that's good.
Right, especially in football and in rugby where there are no helmets. It's very important to, know your tackle style, know how to position yourself, know how to fall, know how to land. Those are very important in the off-season of practice, for sure.
Do you think someday we'll see, or it will continue to grow as far as the mask to use and other devices as well?
Yeah, I think the technology continues to evolve. Shoulder pads, helmets, and the air bladders and those, they continue to evolve and get better and better. And I think they have definitely shown in the literature that the concussion rates have gone way down because of the technology advances.
Yeah. But going to be an accident or two.
There's always going to be several, yeah.
All right, friends, if you would like more information, you can contact Erlanger Ortho South inside the Erlanger Medical Mall, which is Suite C430. Now, phone number 423-624-6584. That's 624-6584. And you can also go online, erlanger.org/orthosouth. You got it? Good deal. Thank you, sir.